Hello, today we'll be talking about schizophrenia. So, before we talk about schizophrenia, let's just talk about psychosis. Psychosis is a general term used to describe a distorted perception of reality. Poor reality testing may be accompanied by delusions, perceptual disturbances, such as illusions or hallucinations, and a disorganized thinking or behavior. Psychosis can be a symptom of schizophrenia, mania, depression, delirium, and dementia, and it can be substance or medication induced. So, what is schizophrenia? Schizophrenia is a psychiatric disorder characterized by a constellation of abnormalities in thinking, emotion, and behavior. There is no single symptom that is pathognomonic, and there is a heterogeneous clinical presentation. Schizophrenia is typically chronic with significant psychosocial and medical consequences to the patient. So let's talk about the symptoms of schizophrenia. So in general, the symptoms of schizophrenia are broken up into three categories: positive symptoms, negative symptoms, and cognitive symptoms. So positive symptoms include hallucinations, delusions, bizarre behavior, disorganized speech. These tend to respond more robustly to antipsychotic medication. Negative symptoms: flat or blunted affect, anhedonia, apathy, alogia, and lack of interest in socialization. These symptoms are comparatively more often treatment resistant and contribute significantly to the social isolation of schizophrenic patients. Cognitive symptoms: impairment in attention, executive function, and working memory. These symptoms may lead to poor work and school performance. So, diagnosis of schizophrenia according to the DSM-5 criteria. So, two or more of the following must be present for at least 1 month. So, delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. And at least one must be from the first, second, or third. And other symptoms must cause significant social, occupational, or self-care functional deterioration. Duration of illness for at least 6 months, including prodromal or residual periods in which the above full criteria may not be met. And symptoms are not due to effects of a substance or another medical condition. So, case presentation. I am presenting RL male 20 who presented with auditory and visual hallucinations, grandiose and persecutory delusions for 7 months. Patient also presented with feelings of sadness for 7 months, reduced appetite, and insomnia for 1 month. And he has 2 attempts of suicide 7 months ago. Currently, he has no suicidal ideation, anhedonia, feelings of worthlessness, or irrelevant talk. So just pause the video and try to think of the diagnosis. So let's look at the positives. So the positives are auditory and visual hallucinations, grandiose and persecutory delusions for 7 months, feelings of sadness, reduced appetite, insomnia, and 2 prior attempts of suicide. So if we can look here, we can find psychotic symptoms as well as some mood symptoms. However, they are not enough to make a diagnosis of major depressive disorder. So our diagnosis is schizophrenia with mood symptoms. So what's the treatment? So again, we use the biopsychosocial approach to include bio, which is the pharmacological approach. Then psycho is the psychotherapy, and social is the social approach here. So a multimodal approach is the most effective, and therapy must be tailored to the needs of the specific patient. Pharmacologic treatment consists primarily of antipsychotic medications, otherwise known as neuroleptics. So these first generation of atypical antipsychotic medications, these include chlorpromazine, fluphenazine, haloperidol, perphenazine. These are primarily dopamine, mostly D2 antagonists. They treat positive symptoms with minimal impact on negative symptoms. Side effects include extrapyramidal symptoms, neuroleptic malignant syndrome, and tardive dyskinesia. Then second generation of atypical antipsychotic medications include aripiprazole, asenapine, clozapine, iloperidone, lorazepam, olanzapine, quetiapine, risperidone, and ziprasidone. These antagonize serotonin receptors as well as dopamine receptors. Research has shown no significant difference between first and second generation antipsychotics in efficacy. The selection requires the weighing of benefits and risks in individual clinical cases. Then some points you need to know is that low incidence of extrapyramidal side effects but increased risk for metabolic syndrome with atypical antipsychotics. And medication should be taken for at least 4 weeks before efficacy is determined. And clozapine is reserved for patients who have failed multiple antipsychotic trials due to increased risk of agranulocytosis. Then antipsychotherapy, we've got behavioral therapy, which attempts to improve the patient's ability to function in society. Patients are helped through a variety of methods to improve their social skills, become self-sufficient, and minimize disruptive behaviors. Family therapy and group therapy are also useful adjuncts. So let's talk about the important side effects and sequelae of antipsychotic medications, and this is very, very important. So let's talk about the side effects of antipsychotic medications. So one, extrapyramidal symptoms, and they are more common with the use of high-potency first-generation antipsychotics. So high-potency first-generation antipsychotic is haloperidol. So what are the examples of EPS symptoms? These are dystonia, spasms of face, neck, and tongue, Parkinsonism, resting tremor, rigidity, bradykinesia, akathisia, feeling of restlessness. So treatment of extrapyramidal symptom is anticholinergics such as benztropine, diphenhydramine, benzodiazepines, beta blockers, specifically for akathisia. Then the second side effect is anticholinergic symptoms. These are common with low-potency first-generation antipsychotics and atypical antipsychotics. So low-potency first-generation antipsychotic is chlorpromazine. So the side effects include dry mouth, constipation, blood vision, hypothermia. So what's the treatment? Treatment is as per the symptoms. So if there's blood vision, you give them eye drops. If there's constipation, you give them stool softness, etc. 3. Metabolic syndrome. This is more common with second generation antipsychotics. A constellation of conditions such as increased blood pressure, increased blood sugar levels, excess body fat around the waist, abnormal cholesterol levels that occur together increase the risk for developing cardiovascular disease, stroke, and type 2 diabetes. So the treatment for metabolic syndrome, you need to consider switching to a first generation antipsychotic or a more weight neutral second generation antipsychotic such as aripiprazole or ziprasidone. Monitor lipids and blood glucose measurements for the patient to primary care for appropriate treatment of hyperlipidemia, diabetes, etc. Encourage appropriate diet, exercise, and smoking cessation. Then 4. Tardive dyskinesia. This is more common with first-generation antipsychotics. These are choreoathetoid movements usually seen in the face, tongue, and head. Treatment is discontinue or reduce the medication and consider substituting an antipsychotic if appropriate. Benzodiazepines, Botox, and vitamin E may be used, and the movements may persist despite withdrawal of the drug, although less common. Atypical antipsychotics can cause tardive dyskinesia. Then 5. Neuroleptic malignant syndrome, typically from high-potency first-generation antipsychotics. So this is characterized by a change in mental status, autonomic instability, high fever, level blood pressure, tachycardia, tachypnea, diaphoresis. This is led by frigidity, elevated CPK, leukocytosis, and metabolic acidosis. This is a medical emergency that requires prompt withdrawal of all antipsychotic medications and immediate medical assessment and treatment. May be observed in any patient being treated with any antipsychotic, including second generation medications at any time. Then 6. Prolonged QT interval and other ECG changes. And there's hyperprolactinemia, which leads to gynecomastia, galactorrhea, amenorrhea, diminished libido, and impotence. Then there's hematologic effects, that is agranulocytosis with clozapine, requiring frequent blood draws when this medication is used. Ophthalmologic conditions, thyroidism may cause irreversible retinal pigmentation at high doses. Then there's deposits in lens and cornea may occur with chlorpromazine. There's dermatologic conditions such as rashes and photosensitivity. So that's all on schizophrenia. Thank you.